Welcome everybody. So SEAL is the Centre for Interprofessional Education and Learning, and we deliver interprofessional activities across 13 health and social care programmes at the University of Nottingham. Myself and Simon, who will introduce himself shortly, wanted to just have a bit of a discussion about some of the interprofessional challenges that we've encountered in our careers, as well as opportunities of interprofessional education and working. And we want to take an opportunity to also share a bit about our career trajectories, our work, and what interests us. So, Simon, could you tell us a bit about your role and how did you end up doing what you're doing currently at our university?
Thank you, Maria. Yes, so I'm Simon Bishop, I'm Associate Professor of Organisational Behaviour at Nottingham University Business School, and I'm also the Director of the CHILL Research Centre, which stands for the Centre for Health, Innovation, Leadership and Learning. How did I end up doing this? I'll start with that. Well, I've been an academic at Nottingham for most of my career, actually. So I started off doing my PhD here, and I've worked being an academic. And what was interesting to me was how health services are changing and what that means for the work of people within them, as well as for the care that's provided to patients. And so I've been doing research in that area over the long term, and I was lucky enough to have the opportunity to get involved in the research centre, which was started about 10 years ago, really led by Professor Justin Waring, a former colleague here. And I was involved in setting up the centre, and over time have become the director.
Thank you, Simon. So we're both centre directors. We've got SEAL, we've got CHILL. We're both associate professors in organisational behaviour, and we're both interested in health systems change. Are there any interprofessional barriers, do you think, that we encounter in our director roles? Because health services research, health education, they can be quite interprofessional. And what does that mean for the delivery of our work, would you say?
Yeah, I think, to my mind, interprofessional barriers are absolutely crucial to thinking about the way that healthcare works. I guess professions themselves are fairly essential to the functioning of high quality healthcare, and people are trained within professional expertise, and that forms the basis of their kind of introduction to working in healthcare, their socialization, and their expert knowledge. From conducting research, it seems that people's professions are really important to them in terms of how they see themselves and what they contribute to healthcare. And on an individual basis, I think there is absolutely a commitment to working across and with other professions and with other professionals as part of multidisciplinary teams. But on a number of levels, there can be challenges to working across and between professional groups that are not because people are not willing to get involved with each other and they're not willing to learn about each other's jobs, but because there are things that get in the way of them doing so. For example, the sort of patterns of everyday work between different professions and professional groups can be different, which just means that there isn't the same chance of interaction and getting to know each other's kind of routines of their role, and the way that their job operates, and the sort of pressures on them, in the same way that there is for learning about your own immediate professional colleagues. And then on an organizational level, there are kind of often different kind of structures in which different professions are operating, so that different lines of management, different forms of promotion, and different rewards for different professional groups, which can mean that over time, and for no kind of reasons that are to do with people trying to steer clear of other professional groups or doing that they can diverge, and it can be difficult. Sort of daily work routines, organizational systems, and then I guess most broadly, the professional associations themselves often sort of mean that the people have different kind of approaches to their work, different forms of knowledge, and I think it just needs ongoing thought about how different professional groups can continue to work with each other to provide high quality care.
Yes, absolutely. And we know from the research evidence how crucial effective interprofessional working is, not only to staff satisfaction, retention, but also patient satisfaction, patient safety. We know that it can lead to a reduction in incidents if people work well and work effectively together around the patient. So at SEAL, we work on the assumption that if our students in the early years of their initiation into their professional groupings, if you like, learn about all the factors that you mentioned, because we tend to take it for granted actually going into the world of work, particularly in healthcare, just how siloed different professional groups can be for the reasons that you described. So for me, one of the first steps is an awareness of that, and that actually, people do have those different rhythms. They answer to different professional groups. They've been initiated into different training rituals, if you like, which produce workers, professionals with certain characteristics. And that can very much pose barriers in people being able to work effectively together. So interprofessional education is a way of breaking down those barriers whilst our students are undertaking their degrees, but also once they go into their careers. We hope that it helps to develop empathy for one another's roles and an understanding, what is it that a dietitian does? What is it that, for instance, a social worker can add to care around my patient? We are also really happy to be working with veterinary sciences as well, because we believe there's a lot for human health and animal health to learn from one another when it comes to organising, when it comes to care around the patient. So it opens up, I think, quite fascinating journeys into learning about one another. Some of the work I do involves facilitating workshops with integrated care systems. So integrated care systems are new ways of organising health and social care where NHS and other organisations are brought together under one umbrella to provide more holistic, we hope, care and more joined up care, and that they talk to one another in care around the patient, but also work together to tackle social determinants of health within a local area. So they're quite place-based. But this poses enormous challenges. How do we get people who haven't worked together previously to communicate better, to share information, to even, get on with one another, to start off with that very basic respect for one another's roles and recognition. And that can be quite challenging because we do away with hierarchies that might have existed for decades and instead look at very flat ways of delivering care. And for me, a lot of that work has involved, and as a psychologist, I guess it's a natural approach that I would take, but has involved the relational. So how can we encourage people to develop empathy for one another, to work in psychologically safe ways where they feel that they can take risks and be held by the group, and to speak openly and to challenge and to bring up where things go wrong and work on solutions collectively. So that work has brought me immense satisfaction. And I wonder, Simon, if through your academic work or through your work at Chill, working with colleagues, if you've encountered any kind of relational challenges and opportunities when it comes to people working together?
Well, yes. I mean, so we're a research centre that's based in the business school, and we work a lot with clinical colleagues and clinical research colleagues. I think one factor is that we are physically located separately from where care takes place. And I think it's really easy to underestimate how much that plays a role. There's a nice concept that, well, actually, it's a bit of jargon because I think it sounds more complex than it is, but it's the idea of functional proximity is one that I've encountered a number of times in my research. And it's basically the idea that the people that we spend our time with and that we're physically close to, we form the strongest relationships with. So as people are trained within their professional groups, it's natural that they gravitate towards other members of those professional groups. And in the workplace, if you share a staff room with members of your own professional group, or you share, an office area with members of your own professional groups, or you're on the wards with predominantly your own professional groups, you identify with them and you feel part of that group. And it's natural for you to then share information with them and to trust them above members who you see as outside of those immediate relationships. One way of dealing with that is, well, it's fantastically straightforward, is to engineer situations in which we can spend more time with people from other groups. There's been a lot of attempts in integrated care programs to do just that, to try and facilitate sort of the physical space to allow people to interact more freely. It's really it's easier said than done, because as well as needing to sort of move people physically, there needs to be conscious attempts to try and organize work so that people are able to spend time with each other. And we know that, that the pace of work in a lot of clinical areas is pretty great now, so that there's not always time to, have those conversations between appointments or between cases, and to, discuss things with close colleagues, as well as, people that you are getting to know as part of, changing work programs. So in some ways it's simple, but in other ways there are lots of barriers to doing it. I think with the move to integrated care, this has been something that's been in the pipeline for a great number of years, and there's a huge amount of evidence that working together across professional divisions can improve care for patients. There is quite a lot of difficulty in coming up with standardized interventions to make that happen. And I think part of the reasons for that is because the way that those divisions take place really depends on the context and the sort of local and regional context in which that is happening. And so I think, the continual policy emphasis on it is potentially a useful thing, but what we need to see is how those programs are going to be taken up by people on the front line in order to actually make any difference to patient care. It can't be something that's done at the kind of managerial and regional leadership level without sort of involving people on the front line, and also from a lot of the kind of the energy and pull towards those kind of things coming from people working in frontline clinical role jobs. And I think it's that, and similarly, going back to our research centre, it can only be, on a day-to-day basis, trying to make contact with people outside of my immediate safe space of colleagues within the business school that, that can really get any interdisciplinary research projects going. So I think there's, I think it's similar for us as well.
So, quick question before we finish: has the proliferation of tech to help us communicate at work, has that encouraged functional proximity or undermined it?
Well, I actually think that's a really interesting question. I think that for the last few years, where there's been an increasing amount of things that take place online, there is really interesting and potentially divergent research studies that point in quite different directions. One suggestion is that online communications does open up new levels of informality between colleagues of potentially different levels, and it allows people to communicate across what would have been previous boundaries, whether they're professional boundaries or hierarchical boundaries or both. And there's a really nice piece of research that I've read recently that suggested that moving consultations between patients and specialists to an online format reduce some of the hierarchical barriers to communication, because the specialists opened up in a different way when they were working online, and they didn't have the reliance of their kind of office and all the technology around them to indicate that kind of space, the status hierarchy, that a different relationship opened up. At the same time, I do think that what is often missing from online communication is some of the sort of more open and trusting communication that took place outside of the formal discussions around work. And so when we're communicating through, for example, Teams meetings, we've all been, I think we've all been there, where the meeting finishes and you fall out of the meeting and you move on to the next task. And that's a very different experience to which would happen in a face-to-face meeting, in which you would probably be walking out of the meetings with colleagues, been discussing things on the way to the car park or on the way to the next appointment. And those kind of incidental meetings, I think, are really important to building strong relationships. And if we don't find space to have some of those conversations, and we don't spend time with colleagues outside of the kind of formal functional discussions of work activities, then we're not going to have the opportunities to understand more about how we can attune our work to other people.
Thank you, Simon. I hope that's been interesting to listen to. Certainly, I think we could keep talking about this. There are so many challenges, opportunities posed through this new world of working in the pandemic recovery phase. And I think what you were saying about engaging the front line is really real. And I think there's such a question mark over how one does that, given the current context of well-being issues, low morale, burnout. Strikes are taking place at the moment during the time of this recording. But certainly it feels to me like interprofessional working strategies to improve relationships at work really help drive a long-term strategy, thinking about the workforce, thinking about what constitutes meaning at work, and how we ensure that the workforce is nurtured and remains well, particularly in our healthcare sector, which of course is crucial to our societal infrastructure. Thank you very much, Simon, for your time, and we hope to do more of these video installments for SEAL as we go on. Thank you for listening.